Thank you, Mr. Chairman, and I'm glad to be here for this hearing. This hearing should be a substantive discussion on how to expand access to care for women. I'm disappointed that my Republican colleagues are using this hearing to make such blatantly false claims. The young lady who speaks in generalization, and for the record, while one side calls themselves pro-life, there's not a person I know that say they're pro-abortion, they're pro-choice. So abortions are not infanticide. That is not how abortion works. And this type of deceptive rhetoric is yet another attempt to distract from efforts to make abortion out of the reach for women to shut down clinics. And I just constantly, I've had this debate a number of times on this panel, the mistruths that are spoken about ripping full-size babies out of wombs and killing them, that is not true. Selling of parts is not true. And it just seems like it's enjoyed to say because it paints this horrific picture. And we should say the truth. Statistics. Mrs. Box, I'm so sorry to hear about the pain you and your family had to suffer. And thank you for bringing the beautiful baby in the room. Have you considered whether this law that is being proposed or passed in Missouri would have prevented you from having an abortion if it had existed 2 years ago?
Thank you. It absolutely would have prevented me from having an abortion. At 8 weeks, which is when the ban that my state legislature passed, it's impossible to know of the chromosomal abnormalities. As far as my understanding, I'm not the doctor here today, but we did the early genetic testing because I am of advanced maternal age, and so not another one of my not favorite terms.
Yes.
But, and so I believe that we found out before most women and families would find out, because we found out earlier because of that. Most people would not find out until the 20-week anatomy scan. And I can say that after Libby, I was obviously able to successfully get pregnant again, as evidenced by my beautiful daughter, who's now being quiet, thankfully. And so I was pregnant during the time that the state legislature was enacting this ban and that Governor Parsons signed this into law. And at our 20-week ultrasound for Astrid, they couldn't get a couple of views of the heart. Everything looked good, physicians weren't concerned, but what should have been a happy day to know that we were having a successful pregnancy, because a pregnancy after a fetal diagnosis is a very stressful pregnancy, ended with me being in the car, my husband and I walking out of the appointment, and me being in the car sobbing hysterically because they wouldn't see me again until I was 24 weeks along. And in Missouri, because they weren't worried, right? That was my next regularly scheduled appointment. And in Missouri, that would have been too late. And what I kept saying to Jake, to my husband, is, what if they find something devastating now? I can't protect my daughter. And I understand that Mrs. Stuckey and I don't agree on things, but I would like to ask you to remember that you're calling me and my husband murderers, and you believe in compassion and love, and I would ask for compassion and respect, ma'am, when you speak about these decisions, because Americans make these decisions that are difficult and personal, and we deserve to be treated with respect whether or not you condone our choice. I don't need your approval, Mrs. Stuckey, but I would ask for your respect.
I appreciate what you're saying. In the few minutes I have left, I just want to bring another issue to the table. We in this country have the highest maternal mortality rate of any civilized country in the world. And for women to be dying to give birth in America is unacceptable. And with the same energy that we're making health decisions and decisions about our bodies, and we should, as women in America, have the same choices that men have without the government telling them what to do. I often use the comparison because now there's discussion about birth control. I would love to have a debate about Viagra and whether the government should regulate or restrict Viagra for men. That's never been on the table. And so women, we are targeted. And for us to have the same passion of a discussion about saving women who want to have their babies, and this medical industry is failing us, we need to have the same passion. I yield back my time.